Welcome to the Knox Community Hospital Bariatric Seminar. Congratulations on taking the first step to a healthier life. I am Dr. McLaughlin, and I will be going through the different weight loss options at KCH. Before we begin, it is important to acknowledge that there will often be group meetings throughout the program, either for education, support groups, or even online groups. We believe that having these group sessions can be very valuable. However, it is also important to respect people's privacy. Not everyone wants to share this journey with their neighbors or friends. We ask you to not share who was present at any meeting or what was said without that person's permission. Please make sure you agree to a confidentiality agreement before continuing with the seminar. Throughout this seminar, we will discuss the disease of obesity and the options for successful weight loss. Finally, we will review our program to help you get started. Obesity is typically defined by BMI, or body mass index. BMI is calculated by using your height and your weight. A BMI over 30 is classified as obese. To determine your BMI, find where your height and weight intersect on this chart. It is important to know your BMI because it determines what treatment options that you can qualify for. The treatment of obesity is so important because of the negative impact it has on health. You may be aware that increased weight can increase your risk of diabetes, elevated cholesterol, and osteoarthritis. But excess weight can also increase your risk of many cancers, liver disease, high blood pressure, and breathing problems. Certain medical conditions that are associated with obesity may also help you qualify for certain treatments. Obesity is a complex disease, and there are many factors that contribute to being overweight. Throughout this program, we want to focus on as many things that we can change to help change unhealthy behaviors, learn more about nutrition, and increase exercise. However, there are certain things that are beyond our control, like our genetics and certain aspects of our environment. The next slide is a video about the body set point theory, which explains why many people may have had trouble losing weight in the past.
You might know someone like Amanda. She's a 42-year-old mother with a 6-year-old son. Her baby is just starting first grade, and Amanda looks forward to seeing him grow and enjoy a happy life. But Amanda is concerned she will not live long enough to see him finish high school. She's been struggling with her weight, and in recent years, it has become a serious threat to her health. She is dependent on large doses of insulin for her diabetes. Her joints are so painful that she can barely walk beyond her garden. Amanda has worked very hard to lose weight in the past. She tried many types of diets and worked with weight management specialists to control her weight. Even though she lost some weight with each new diet and exercise routine, the weight always crept back on, and then some. She wanted to lose the weight on her own, but she felt like her body just kept failing her. What Amanda didn't know is losing weight and maintaining weight loss is a lot more complicated than simply eating less and exercising more. Historically, people have believed that body weight is determined by the energy balance equation. If you consume more calories than you burn, you gain weight. If you burn more than you consume, you lose weight. We view obesity as a lifestyle choice, and the cure for it is simple: eat less and exercise more. This assumption may sound logical, but it can be wrong. One theory, called the set point theory, suggests that no matter what you want to weigh, your brain has a certain weight range and body fat level that it works to maintain within the set point range. This means that you don't control your body fat consciously. Rather, your brain manages it like it does your breathing and heart rate. Your brain receives information through hormone signals from your body fat, muscles, pancreas, liver, GI tract, and sensory organs at all times, and controls your appetite, digestion, energy balance, and metabolism. Once your set point has been elevated, your body works to defend it vigorously. What happens when Amanda starts a diet? She might be able to lose some weight temporarily, But hormone signals from her body change in response to weight loss and tell her brain to increase calorie intake and slow down calorie burn to restore the body fat she's lost. She feels hungrier, and although she doesn't know it, she's also burning calories slower than before. Amanda's body doesn't recognize that her set point is too high and her weight is unhealthy. It only knows to defend her current set point. Think about her system like a house with a broken thermostat. If the thermostat gets set too high, you might be able to cool the house down temporarily by opening a window, but the sensor would detect the temperature change and heat it up again until it reaches the temperature set by the thermostat. This might explain why treating obesity with diet and exercise so often fails to produce the desired results. It's sort of like telling Amanda to open the window to let some cool air in, when the real problem is that she needs a mechanic to fix her thermostat. Okay, so if the set point system prevents us from losing weight, why doesn't it also protect us from gaining weight and developing obesity in the first place? It actually takes a perfect storm to cause an obesity epidemic. Changes to the chemical and nutrient content of our food, the so-called Western diet, a decrease in physical activity, increased levels of stress, inadequate and disrupted sleep, and more widespread use of medications that affect metabolism and promote weight gain, all appear to play a role in elevated set points and rising rates of obesity. And Amanda responded to those environmental changes by sending hormonal signals that elevate her set point for body fat. What can you do with the elevated set point? Back to our thermostat analogy. Amanda's room temperature was set too high, and she needs to lower her thermostat temperature, or in other words, find a way to lower her set point. She needs to find a way to make her body regulate itself to a new lower weight. One option for Amanda to consider is bariatric surgery. In study after study, it's been shown to currently be the most effective long-term treatment of obesity. So how does bariatric surgery work to help people lose weight and maintain that new lower weight? Most people, even many doctors, think that bariatric surgery works only for restricting food intake or preventing calories from being absorbed. This is true, but there is more to it. Research suggests that certain types of bariatric surgery also affect the signals between the brain and the body and cause decreased appetite, increased feelings of fullness, increased metabolism, and even preferences for healthier food. These surgeries appear to produce signal changes that reset the body weight set point to a new healthier level and stop the brain from encouraging weight regain in response to dieting. Bariatric surgery may also affect hormones that help to regulate your overall health, which may explain why some types of bariatric surgery can resolve or improve type 2 diabetes. So here are 3 things you can take away from all of this. 1. Body weight and body fat are highly controlled by a complex system. 2. Obesity is a disease where the complex system that controls body fat may malfunction, resulting in a set point that is too high. 3. Bariatric surgery may work by changing the signals that control the body fat set point, enabling patients to successfully lose weight and keep it off for long term. Bariatric surgery is shown to be the most effective long-term treatment for obesity. To learn more about surgical obesity treatment and the journey for a healthier life, visit www.thehealthpartner.com/WLS.
The Bariatric Medicine program at Knox Community Hospital is a comprehensive program just focused on treating obesity. So whether you're ready to explore the option of bariatric surgery or you just want expert medical help in losing weight, our multidisciplinary team is ready to help you take the next steps. I am Dr. Ava McLaughlin. I am a general surgeon and a fellowship-trained bariatric surgeon. I look forward to meeting with you if you are interested in any of the bariatric surgery options. Dr. Benny Upchurch is a gastroenterologist. You will meet with him if you are interested in any of the endoscopic procedures. Amy Fehrenbaugh is our nurse practitioner. She will meet with you initially and then follow you monthly to track your progress. She will also help guide you to different weight loss treatments. Kate is our program manager. You will meet with her for information about our program. She is a great resource for any questions. Natalie is our dietitian, and you will meet with her for education about nutrition, as well as any information about postoperative diets if you choose to pursue surgery. At the Center for Rehabilitation and Wellness, we utilize wellness coaches that can help develop personalized goals and help identify behaviors that may have kept you from success in the past. We also have exercise physiologists that will help teach you new exercises that can be done safely, keeping in mind any potential physical limitations. Any individual who needs help reaching a healthier weight can enroll in the medical weight management program. The medical weight management is the foundation of our program and can be done alone or in conjunction with an endoscopic procedure or a bariatric surgery. The medical weight management program includes meeting with the wellness coach, exercise physiologist, and dietitian. Throughout the program, you will also be followed by our nurse practitioner and may be prescribed medications if you qualify. There are several FDA-approved endoscopic options for weight loss. These can be options for patients who either don't qualify for surgery or who are not interested in undergoing a surgical procedure. These are typically done under sedation, however, they are not usually covered by insurance. There are currently 2 bariatric surgeries offered at Knox Community Hospital. These are the laparoscopic sleeve gastrectomy and the laparoscopic Roux-en-Y gastric bypass. Laparoscopic means that these are done in a minimally invasive manner by using a camera and small incisions. These 2 bariatric surgery procedures are both very effective for weight loss and are the most commonly performed procedures for weight loss today. The laparoscopic sleeve gastrectomy is performed by removing a portion of your stomach. This can help you lose weight in 2 different ways. First, the stomach is smaller, which reduces the amount of calories that you can take at one time. Also, removing that portion of your stomach affects hormones that are related to hunger. Used with proper lifestyle changes, you can lose 60% of your excess body weight. Next is an animated video discussing this surgery.
To access the abdominal cavity, small incisions are created. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes. These help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 and 150 milliliters and is about the size of a banana. The resected portion of the stomach is removed. By altering the anatomy of the gastrointestinal tract, sleeve gastrectomy changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. Bile and pancreatic fluid from the liver and pancreas mix with food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or postoperative adjustments needed for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
For the laparoscopic Roux-en-Y gastric bypass, the stomach is divided into a small pouch and separated from the remainder of the stomach. The small intestine is divided, and part of the intestine is brought up and attached to this small gastric pouch. The intestines are then brought together and connected in a Y shape. This affects weight loss in several different ways. The small gastric pouch restricts caloric intake. The food that you eat does not go through the normal stomach or the first part of the intestines, but instead it bypasses these areas. This affects the hunger hormones and your feeling of fullness. It also causes malabsorption, which decreases the amount of calories absorbed from the food that you eat. Done with proper lifestyle changes, you can lose up to 80% of your excess body weight. The animated video in the next slide will help explain some of these surgical steps.
To access the abdominal cavity, small incisions are created. Trocars are placed to serve as passageways for surgical instruments. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes. These help break the food down into a simpler form so that it can be digested more easily and absorbed in the small bowel. During a gastric bypass, a small pouch is created in the stomach using a stapling device. The small stomach pouch, about the size of an egg, limits the amount of food you can eat before feeling full. The small bowel is separated into two sections. The lower portion of the small bowel is attached to the newly created stomach pouch. This allows food to pass directly into the second portion of small bowel, where digestion continues. The upper portion of the small bowel is reconnected to the lower. Bile and pancreatic fluids from the liver and pancreas allow food to be digested completely. By altering the anatomy of the gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
Bariatric surgery has been proven to be a very safe surgery and the rate of complications are low. However, all surgeries have risks. It is important for you to be aware and understand these possible complications. Listed in this slide are the risks that are associated with the operation and typically occur at the time of your hospitalization. These risks are very similar between both the gastric sleeve and the Roux-en-Y gastric bypass. Please read through this list and feel free to ask any questions at our surgical consultation. In addition to the surgical risks, each procedure has possible long-term risks. This slide lists some of those complications. Some complications are similar between the two surgeries and can occur after any abdominal operation, such as a hernia at one of the incision sites or a bowel obstruction due to scar tissue. However, there are some important differences between the surgeries which can help you determine which surgery would be best for you. There is a risk of new or increased heartburn or GERD after the sleeve gastrectomy. If you have severe heartburn before surgery, then the gastric bypass may be a better option because it can decrease reflux. However, the gastric bypass has several unique complications. A marginal ulcer or ulcer at the new anastomosis can occur. It is important to avoid alcohol or smoking to decrease your risk of developing these ulcers. An internal hernia is a possible complication due to the space that is created by rerouting the intestines. If you have abdominal pain or bowel obstruction, it is important to go to a hospital that has a bariatric surgeon, as this is something that can be missed and it typically requires an operation to free your bowel as soon as possible. Dumping syndrome or other metabolic issues can occur. Dumping syndrome typically occurs after eating foods high in carbohydrates or sugars and can cause nausea, diarrhea, and abdominal pain. Nutritional deficiencies can occur with both operations, but there is typically a higher risk after gastric bypass. It is important to take all the recommended nutritional supplements and continue to follow up with your bariatric team for monitoring of your lab work. The gastric bypass can also affect the absorptions of some medications, which will need to be taken into consideration when planning for your surgery. After surgery, you should expect to stay in the hospital for at least one night. As soon as you wake up from anesthesia, you will be expected to get up and start walking with assistance. Walking is very important to help reduce your risk of developing blood clots, which is a very serious condition. Most patients are able to begin drinking clear fluids in small amounts a few hours after surgery and can be expected to be advanced to full liquids, including protein shakes, by the time they are discharged from the hospital. Your bariatric dietitian will explain your diet in more detail. I will be prescribing you multiple medications that you will need to take immediately after surgery. These medications include things to help prevent blood clots, help decrease the risk of gallstone formation if you still have your gallbladder, reduce nausea and stomach acid, and vitamins and supplements to help prevent nutritional deficiencies. Your bariatric nurse will go over all your prescriptions during your preoperative teaching class. Proper hydration is very important following your surgery. Because you have a new, smaller stomach, you will be limited in how much fluids you can drink at one time. For this reason, it is very important to develop and stick to a fluid schedule to make sure you hit your daily goal. Dehydration can slow down your recovery. Protein is very important to help you in recovery and healing after surgery. If you don't take the recommended amount of protein, you may experience poor wound healing, fatigue, nutritional deficiency, and even hair loss. Vitamin and mineral supplements are a lifelong commitment following bariatric surgery. Vitamins are formulated to deliver the extra nutrients you require following surgery. The exact amounts will vary based on the type of surgery you have, as well as your body's current needs. Regular follow-up and support is very important in having successful outcomes following your surgery. In addition to attending your follow-up appointments, it can be very beneficial to get involved in support groups, whether that means in-person group meetings or online participation. Finding a support group adds many benefits to your recovery and your new lifestyle. For the first 4 to 6 weeks, hydration and nutrition will be your full-time job. Although you may feel physically able to return to work after a few weeks, during the day you will need to focus on eating and drinking every 1 to 2 hours in order to meet your fluid and protein needs. You will receive education from myself and the bariatric dietitian regarding your postoperative diet, but there are several important guidelines to keep in mind. It can be helpful to begin practicing these habits prior to your procedure in order to make it easier to adhere to after surgery. Some other considerations that are important to discuss. If you are a woman that can become pregnant, it is important for you to have a reliable method of birth control. Becoming pregnant soon after bariatric surgery can be harmful. It is also important for you to know that you may be more likely to become pregnant even if you've had difficulty with fertility in the past. Also, estrogen birth control will need to be held around the time of surgery to help decrease the risk of blood clots, so an alternative form will need to be used. Smoking can increase your risk of blood clots, infections, leaks, and ulcerations. For these reasons, we cannot proceed with surgery if you are still using any products containing nicotine. Everyone will be tested for nicotine, even if you have never smoked. The preoperative requirements are there to achieve several goals. The first goal is to prepare you for your surgery and to help give you all the tools that you need for success. This includes support groups, classes. We also need to know that you understand and are committed to the lifestyle changes that are required. The second goal is testing to understand and to try to reduce your medical and surgical risks. This includes screening for sleep apnea, preoperative testing with lab work and the EGD, the psych evaluation, and making sure that you are up to date on all your recommended medical screening. The third goal is to comply with all your insurance requirements so that your surgery is properly covered. These are some general guidelines for candidacy in our program, but we will discuss your situation in more detail at your initial appointment. Congratulations on completing the first step. Please make sure you fill out your contact information so we can schedule you for your initial appointment with our nurse practitioner. Prior to that appointment, you will be getting paperwork. It is very important to fill out your health packet and weight history paperwork and bring it to that initial appointment. Thank you for attending our online seminar.